The provinces have the authority to determine what is in their best interest.
We're now in the position to start working towards reopening.
Today we announce our plan to reopen primary schools and childcare services.
We have tremendous confidence in the provinces who very much want to make sure that this happens the right way.
No one wants the economy to open up more than I do, but we can't take anything for granted.
It wouldn't make sense to wait 6 months before they go back to school.
We are going to have to be very careful. That caution will remain because at any time, if we loosen our measures too much, we could find ourselves back in a tremendous spike.
One country on multiple paths to reopen the economy. Hi, and welcome to Power and Politics. I'm Vashi Capellos. The federal government says it's working on a shared set of guidelines to support provinces as they look to lift COVID-19 restrictions in place now for more than 6 weeks. But some provinces have already begun to move at very different speeds. Today, Ontario announced a 3-stage plan to reopen businesses and allow more public gatherings. It doesn't, however, come with any start date or very many details at all because the province has yet to see a consistent drop in COVID-19 cases. Public health officials say the first stage of the province's plan is still a ways off. Quebec, meanwhile, Canada's worst-hit province, says it will begin reopening elementary schools and daycares in just 2 weeks, and plans for reopening other sectors will follow tomorrow. Hi, Minister Joly. Good to see you again.
Good to see you again. So, Vashi, what do you want to talk to me about?
Minister, I want to start off with the wage. Well, I do want to get, to the wage subsidy program, but I actually want to start off by asking you about some of the various provinces' plans announced today to kind of reopen the economy or reopen society. First of all, Quebec has announced that it will reopen elementary schools and daycares outside of Montreal in 2 weeks' time. Do you think the science supports that decision?
Well, obviously, this is a question that is up to Quebec to answer, but what we want to do is to collaborate with the provincial government to make sure that the decision-making is based on science, but at the same time that we keep Quebecers and Canadians safe. And we've been engaging a lot with Premier Legault. Prime Minister Trudeau and himself have been in close contact with all the premiers, and definitely we think that we can continue that collaboration while making sure that we can bit by bit reopen the economy and at the same time keeping the trust of the people in public health authorities' expertise.
When you talk about that collaboration, Minister, and the Prime Minister has spoken about the idea, for example, of federal guidelines, I am wondering in the case of Quebec how it applies because, yes, it's up to the Premier, of course, to make that decision, but we are seeing, for example, people who represent teachers' organizations or school boards voice their concern about heading back to school this early. How does the federal government navigate some of those differences in positions?
Well, this is not about developing federal guidelines. It is about developing guidelines that are applicable to all provinces and territories. And we do that collaboratively with all the premiers and all jurisdictions. The province has a duty to do so and an obligation, of course. And we're there to support a national approach. I'll give you an example of what we've been working on is, for example, how can there be enough personal protective equipment in different jurisdictions as they're reopening bit by bit their economies. So these are the things we're working on right now. At the end of the day, Vashi, the idea is to make sure that people's health is protected, secured, and at the same time that we can do it in a coordinated way while all the supply chains are really completely intertwined. And not only that, we need to make sure that we contain the spread of the virus.
Let me pick up, Minister, on the example you provided around personal protective equipment, because as we listen to various premiers talk about a timeline for reopening the economy, you're right. All of those businesses are going to need increased personal protective equipment, maybe even businesses that wouldn't have used them in the past. I'm thinking, for example, of hair salons in Saskatchewan, which are slated to reopen at the end of May. Does the federal government believe that the country currently has enough PPE to support a staggered or phased out approach to reopening the economy across different provinces?
Well, what we believe is that we need to make sure that we always increase our PPE equipment supplies. And that's why nearly every day, definitely every week, we're getting new shipments from China. But meanwhile, for the first time in decades, we've been developing our own capacity to really generate and fabric new PPE. And it is great to see that a New Brunswick company is partnering with a Montreal company and a Southern Ontario company to make sure that that happens. Quite frankly, we never had this really strong supply chain in the country to have that. But we know that we need to really increase our capacity in the country. And so as we're moving ahead, that these equipment that are made in Canada for Canadians is ramping up, and that will help also provide supplies for all across the country as we're reopening bit by bit the economy.
I take your point, Minister, on the sort of increase in domestic capabilities, certainly. I'm wondering, though, has the federal government done a quantitative analysis of how much PPE there is and how much is going to be needed and what is the gap? Are you able to share that with our viewers?
Well, what we've done is really work with provinces and territories as they would ask us the number of PPE that they would have. You have to, viewers need to be reminded that, of course, healthcare systems and frontline workers are really under the jurisdiction of the province and territories. So it's the first time that we play a role of coordinating all these efforts and creating also supply chain in Canada through the fact that we've, issued letters of intent to businesses in Canada and passed orders to afterward redistribute the supplies based also on the need and the reality linked to COVID-19 across this country. And that's one, I think, of the biggest reasons why the Prime Minister and the Premiers have been talking every week since the beginning of the pandemic, because this was always one of the priorities that was discussed in the context of these phone calls. So the numbers will fluctuate, but definitely we have to ramp up our capacity, and that's exactly what we're doing.
Yeah, I get exactly what you're saying, Minister, and I understand the jurisdictional issues as well. I guess I'm just trying to understand in layman's terms, when we do start all going back to work, are we going to have the personal protective equipment that we need?
Well, that's exactly why, as a government, we want to make sure that this is part of the thinking across different jurisdictions, while provinces are going ahead in announcing how they will be reopening their economy. There needs to be enough personal protective equipment, PPE, for frontline workers, for also different types of essential workers, but also bit by bit workers that are part of this new reopening the economy. And so we'll be working with provinces, but that is paramount to our thinking.
On the wage subsidy program, Minister, I do want to ask you about a certain subsect of business owners we keep hearing from, those who have not put themselves on the payroll. So, for example, they hire contract workers or they pay themselves in dividends. So these are very small businesses that have also trouble qualifying for the emergency loan that your government set up through banks. Is there going to be something coming out that addresses their needs?
So we've been moving very quickly to make sure that we could adapt bit by bit. So, for example, the CBC account, which is the $40,000 loan, which includes a $10,000 forgivable subsidy. Well, at the beginning, it was $50,000 of wages and up to $1 million for businesses to have access to it, and it became $20,000 to $1.5 million. So we've been really moving fast on this. Today is a good news because today businesses can finally apply to get the wage subsidy. That will definitely help a lot of businesses. They will receive their first deposits May 7, so good news. And as for the other issues when it comes to supporting directly owners of small businesses, if they fall through the cracks, they can come to the regional development agencies that's certainly something that we've been working on. I'll be announcing the details this week. And it is, for example, ACOA in Atlantic Canada, DEC in Quebec, FedDev, FedNor in Ontario, and WD, Western Diversification, so in the West, and CanNor in the Great North. So this is a way to make sure that businesses don't fall through the cracks. And we've been really working extremely hard to make sure that we move very quickly and we adapt.
Okay, I'll leave it there. Thank you, Minister Joly. Appreciate your time.
Thank you, Vashi. Take good care.
And we've been discussing throughout the evening various economies, various political leaders, I should say, talking about reopening their economies, including Ontario Premier Doug Ford, who unveiled today his government's plan for reopening the province. Ontario's plan comes in 3 stages, but notably lacks any hard dates. And before it can even begin, the province needs to see a consistent 2 to 4 week decline in the number of daily new cases. So where do things stand right now? And what more do infectious disease specialists want to see in the plan to reopen the province? Dr. Gerald Evans is the chair of the Division of Infectious Diseases at Queen's University. He joins us from Kingston. Hi, Dr. Evans. Thanks for being with us.
Hi, Vashi.
And thank you for your patience this evening. I do want to start out on the question of reopening the economy, and first what it's predicated on. The government today, the Premier said they've got to see a decline in cases for a 2 to 4 week period for the first phase to start and then for every phase thereafter. Is that bar the right one?
Well, it's one of the bars that we need to look at, and it's obviously incredibly important. Having said that, there's a number of other things that really need to come into play before I think there's a really strong move forward to opening up an economy or relaxing some of the social distancing measures. And those are things like the health system's capacity, the incident tracking, the testing that we're going to be able to do to actually be sure we know enough about virus spread and containment to be able to determine that first factor you talked about. And then the other one is public health capacity, how we can sort of deal with it. So there's a lot more to it, I think, than just simply that. But it's at least a good start to recognize that has to be in place before we move forward.
I definitely want to pick up on the testing aspect of all of this, because I find, and maybe it's due to the fact that I'm absorbing all these different press conferences every day, but I'm kind of confused about the level of testing that is necessary in order to impart a sense of confidence that Sector A or Sector B or Business A or Business B can reopen. And maybe it's just not easy to quantify, but for example, based on the level of testing that we're doing in Ontario right now, does it have to be a lot more before we're at a point where it can help guide the reopening of the economy?
Well, I think it needs to be a little certainly above where we are at the moment, although where we are at the moment is a substantial improvement over where we were. But having said that, I think the one that strikes a lot of us who study infectious diseases and work in the field and take care of patients is that the testing we're talking about is a test for the virus. And we know that there are significant issues with how valuable it is as a prediction tool to say you don't have the infection and to say you do. And that testing actually has to come from what we call serological testing. And that is to look for evidence that you have been infected using a test that looks for antibodies in your blood. And that we're a long way away from. And that's actually the information or the test that we're going to be able to use to really give us a good answer about how many people in the population have been infected, and therefore tell us a lot about where things are heading with a second wave if that were to occur and how much we can do. So I think it's really important the public understands that the test we're using now is a diagnostic test, and it's good for me as a physician to sort of test somebody and say you have the infection or you don't have the infection, especially if they have symptoms. But as a test looking for the sort of prevalence of the virus in the population, it leaves a lot to be desired, and we really need a different kind of test, and that's well off at the moment.
Yeah, what do we know about the accuracy of serological testing, given that we have seen some reports in the United States of a lack of accuracy on some of the tests being done there, and we know that it's still undergoing an approval process with Health Canada in this country?
Yeah, it's important to know. So serology means looking for antibodies in your blood, and there have been a number of tests that have been put forward. The CDC, as you just commented, released a report saying most of them aren't very effective. We still don't know what the best one will be, but it's very different from the test that we currently use that people are hearing about and talking about, which is not a test for antibodies. It's a test for the virus from a sample that's obtained from your respiratory tract. And those really answer two very different questions.
How will we know that serological tests are, I guess, accurate? Or how long before? Do you think it's, given that they're already sort of in use in some parts of the United States, but they are seeing those accuracy issues, do you think it's a ways off before we're able to accurately use them here in Canada?
Yeah, I think so. I think there's still a way off. So we're going to be stuck with this direct test. And the way they're looking at it is to look at people who we know have had the infection because we had a direct test that was positive on them, and then look at what sort of antibody measurements we're making in their blood to determine which one most accurately identifies people who have had the infection and distinguishes them from people who have not had the infection. So we're a ways off from that. We're almost still literally in a development phase when it comes to that serological testing versus direct virus testing.
The follow-up question I have for you is what we saw out of the WHO this weekend, which was later clarified, but essentially that there is a lack of evidence that because you have the antibodies or the antibodies present in these tests, that you are therefore immune to getting the virus again. Can you help us interpret that? Is that because of a lack of data, or is that because people aren't immune?
Yeah, no, it's because there's a lack of data. So when you don't have the evidence, you state you don't have the evidence versus the things. So what we know about it already is that people who have recovered from this illness, if we take antibodies from them in the form of serum and we administer it to people who are sick, they actually show a response, a clinical response, and improve. So there's something in the blood of people who have recovered from this illness which is clearly helping people who are sick with the illness, and therefore I would really by extrapolation suggest that there's fairly good evidence that there is an immunologic response that protects people after they've had the infection. So the WHO statement, which, as you point out, they clarified, was to point out there wasn't a lot of evidence to support that idea. But I think the view of myself and many of my colleagues are when you recover from this infection, you will have some immunity. How long that immunity lasts is a bigger question, and we're going to be able to answer over time. But I think I need to disavow the idea that somehow you recover from this infection and then the next day when you walk out, you could get infected again. That we have no good evidence ever happens.
We are very much in this country having a discussion about opening up the economy as well. Quebec, for example, talking about sending kids back to school outside of the greater Montreal area in 2 weeks. And in Ontario, also Premier Doug Ford laying out a plan, a multi-phased approach to reopening the economy there. Phase 1 would see select businesses reopen with restrictions and allow some small gatherings. Phase 2 would see more businesses reopen, larger gatherings. Phase 3 would see all businesses open, quote unquote, responsibly. But to even get to that first phase, Ontario essentially has to see 2 to 4 weeks of declining cases. So we want to talk a little bit with two people who know a lot about the economy, not just in Ontario, but across this country. Let's bring in Rocco Rossi. He's the president and CEO of the Ontario Chamber of Commerce. He joins us from Toronto. And Goldie Hyder is the president and CEO of the Business Council of Canada. He joins us from Ottawa. Hi to both of you. Great to see you. Thanks for being with us.
Pleasure.
Thank you for having me.
Rocco, I want to start with you. The opposition is criticizing the government in Ontario, though it has been, everyone's been getting along pretty well. Today, they were critical of the lack of detail in the plan that was offered by the provincial government. Your take on that plan?
Well, I think the key is that they've underscored in no uncertain terms that the rollout of the opening will happen on an evidence-based basis. That will follow the science, that will follow the trends in the public health care space, because healthcare policy and economic policy are one. The last thing we want to have happen after all of the sacrifices that people have already made and will continue to make is to throw ourselves back to the beginning of this process with another spike. So I think what you've seen and what the Premier went to lengths to underscore is that this is a roadmap, not a calendar. You have to hit the milestones and the benchmarks, and that will trigger the next stages. Would we like to go sooner rather than later? Absolutely, but we want to do it appropriately.
Goldie, what are you hearing from your members? How are they balancing out the sort of economic pressures they're under, having to essentially close down everything, with the calculation they have to make about the possibility of reopening and another surge happening and us kind of having to go back to square one again?
Well, in the case of my members, of course, many of them are global, so many of them have been through this in other countries and learned the lessons, both what to do and also what not to do. And I think that's very important here because, as Rocco rightly says, it's okay if we have a U recovery or a V recovery, but what we cannot afford in Canada is a W recovery. The idea of a second shutdown would be catastrophic, both psychologically and economically. And I think that, you know, the government of Ontario today should be credited with being honest with people, that what they have said is we don't have all the answers. We don't know exactly when and exactly which businesses are going to be opening up. What we want to do is work with an outreach approach. I mean, Premier Ford is the gold star when it comes to reaching out. I've heard from him many, many times over the course of this crisis, and many of his cabinet ministers as well, to try and work together to figure out how do we do this responsibly. Because the one thing we cannot afford is to lose all the progress that we made in being able to contain this virus. And we cannot lose sight of the fact, and this is another thing I will applaud, we have to be driven by the health advice. That also means businesses are going to be looking to governments to say, it's on you to make sure that you're able to provide us with the guidance that's necessary on the safety of our workplaces for our employees and for our customers, but also the equipment that's going to be necessary, the masks, the sanitizers, and so forth. We need to be able to work together to do this, so there's consistency in all parts of Ontario and in all parts of Canada, quite frankly.
Yeah, I take that point definitely, and Rocco, I totally understand the sentiment of not wanting to attach themselves to any specific date. I guess I contrast it, and obviously the position we're all in when it comes to the virus is different depending on the province you're in. But I heard from a number of people who run businesses in Ontario today sort of asking, well, which category am I in? You know, where would I fit? Even if I don't know the day, am I a business that might see myself in the second phase or the third phase? So I think there was a bit of detail missing, but I do take your point, Rocco, and Goldie's point as well, that, you know, it's probably not safe to attach yourself to any specific date as far as the government is concerned at this juncture.
Right. And part of this is also on us. The reality is, if you are a business that either can or can adapt to ensure that you run while maintaining significant physical distancing, and to Goldie's point, that we have a significant ratcheting up of PPE, which up until this point rightfully has been prioritized to our frontline healthcare providers, where it should be. And businesses, our members, Goldie's members, have been stepping up, have been converting capacity to add to that stock, but we need to do more on that front. You combine those two things and you can start to open up. Then add to that far greater testing, far greater contact tracing, which is on the government to build out that capacity so that we can give confidence to consumers, to employees to come to work, to go to shops, to participate in the economy. Because, you know, opening it alone isn't going to ensure that the economy gets started. People have to show up and participate. And for that, they need far greater confidence than they have today.
That's a great point. And actually, Goldie, I wonder what perspective you have on that. I just did a hit with our colleague, Katie Simpson, who's in Georgia. And I had been following along with her tweets and her Instagram post today, because what they showed was that even though the economy had been, quote unquote, reopened there, most businesses had very few patrons in them because people did not, it appears, feel safe or sure that they would be safe in those areas. How significant, and what do you want to see, Goldie, from the government when it comes to testing, being able to impart that sense of confidence on consumers when that great day comes and those businesses are able to open again?
You know, let me keep this simple. We need to test a lot more than we currently are. We need to have random testing in addition to just testing those with symptoms. We have got to create confidence in the public that we are on top of the virus, that it's not coming back in any way, and it's not getting ahead of us. We also have to be honest with people. There are going to be flare-ups. You know, Premier Mo announced the opening of his plan, and coming up on May 4th, there was a flare-up the day after. They're able to track it, they're able to trace it, they're able to contain it. Happened in Alberta as well, and it's happening in parts of Ontario and Quebec and other parts of the country. So we have to be honest with Canadians. We need to learn how to coexist with this virus for an extended period of time. And I think that what you saw today was in part a recognition that as other provinces jump out in front of some of these of the restarts, you don't want Ontarians to start saying, what about me? I also want to go back. I also want to be in that position. So this was more, I think, of a moment to say to Ontarians, your turn will come. Be patient. We've got a ways to go here still because the virus has been, prevalent here in Ontario and Quebec. We've got to do more testing. We will get to the opening, and I think the sub message of today was not anytime soon. It could be a month away still, but we will get there. And so we want to create confidence, but we also want to make sure that the government is able to do its part of the equation, particularly around testing, which you've asked about and Rocco's spoken about and that is something that Canadians are going to be looking for, because without it, I'm not sure you're going to see restaurants fill up again anytime soon.
Okay, I have to leave it there, but thank you very much to both of you for your insights this evening. Really appreciate it. Thanks to Rocco Rossi, President and CEO of the Ontario Chamber of Commerce, and Goldie Hyder, President and CEO of the Business Council of Canada.
Stay strong.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.